Good afternoon and welcome to Brunel University London's Public Health and Health Promotion MSc online presentation with Q&A. During the next hour, you'll have the opportunity to view a presentation from Dr. Nana Anoche, who will be talking about the course. I now have pleasure in introducing Dr. Nana Anoche.
Thank you very much, Yasmin. I'd like to say good afternoon, morning, evening to you all, depending on your location. And a hearty welcome to a webinar for MSc Public Health and Health Promotion here at Brunel. And I also like to take the opportunity to say thank you very much for taking time off your busy schedule to join us today. So what am I going to talk about in the next 20 minutes? First, I'll talk you through the division in which this course sits, and then I'll tell you about the structure of the course, taking you through the study blocks and the assessment blocks, and then I'll end up trying to answer the so-what question. What next after this course? What are your career opportunities, etc.? And hopefully, I hope at the end of these 20 minutes, I would have contributed in making it possible for us to see you come this year or the very near future. The Masters in Public Health and Health Promotion sits in the Division of Health Sciences. The division is a multidisciplinary one made up of public health, health promotion, and health economics. And I'm glad to say that you'll be taught by lecturers who have got strong research profile with expertise in health economics, aging studies, welfare health, and well-being. And they also have a very strong external profile, with many of them sitting on funding bodies both around Europe and elsewhere, in Africa, Asia, Australia, and America. So what is the curriculum of this course? The curriculum of the Masters in Public Health and Health Promotion was informed by a range of subject disciplines. And these subject disciplines cover global public health, health promotion, epidemiology, demography, policy, sociology, psychology, geography, and history. And actually the overarching aim here is to help advance the knowledge of students around the principles and theories in health promotion and public health. And in addition, to equip students with the skills in statistics, qualitative, quantitative analysis, the conduct of systematic reviews, as well as communicating their evidence to various media. What are the aims of the course? The first aim of this course is to investigate the scope and nature of contemporary public health and health promotion. And here we're talking about at various levels, including the local, national, and global levels. In addition, we also intend to explore the major determinants of health and explore ways to promote public health and health promotion. We also plan to build knowledge and skills in reflective practice as well as communication. And this is to enrich you with the skills of working in diverse groups. And we also hope that at the end of the course, you would have developed knowledge and skills in the principles and complicities of using evidence, particularly those of you who would like to move into research, or those of you who, by default of the work that you find yourself in, will need to communicate evidence based on research outputs to other people. In doing this, we explore a multidisciplinary approach to enrich you with the skills and knowledge in public health and health promotion. And we also hope that at the end of the course, we would have been able to examine ethical, political, societal, and the cultural dilemmas that arise in public health and health promotion. And finally, we will provide you with the opportunity to conduct an empirical research project in a contemporary issue associated with public health and health promotion. Now, to achieve the aims that I've just talked you through, we'll structure the course into 8 key study blocks. These study blocks cover global public health, health promotion, health and society, evidence and communication, which is to inform you and to equip you with a skill to communicate your evidence to both academic and the non-academic audience. And there is also a study blog on health policy, politics, and social justice, as well as implementing change. Now, in addition, we've got 2 other blocks. These 2 blocks, one is approaches to research methods, and that principally is to inform you or to teach you the skills in conducting research, mainly around quantitative analysis. And that's not all. We also take you through conducting surveys, i.e. data collection, be it qualitative or quantitative data collection, as well as how you go about analyzing that data and writing a research proposal. And that knowledge is transmitted through the study blog called Research in Practice. Now, at the end of your study blogs, at the end of the program, we expect you, for the full-time students, we expect you to dedicate about 9 months in writing your dissertation. And this dissertation will be around the contemporary issue in public health and health promotion. How would we assess you? There are 7 main assessment blocks here. The first 6 that I will talk you through will give you 120 credits. And then the final assessment, which is dissertation, gives you 60 credits. And for the assessments, they will cover essays, examination, as well as oral presentation. Now, the social context, and these include, for the first one will be social context of public health and health promotion, which will be an essay, and that will give you 15 credits. Then there will be oral presentation and seminar report, which you produce in line with the study blog on communication and evidence. And then comes the research methods and skills. In that assessment, the expectation is that you produce a research proposal ideally related to the contemporary issue that you intend investigating as part of your dissertation. So you can see there is a clear link between the assessments. They link to one another. And then you've got a case study, which will be as part of public health and health promotion. And then the approaches to research is an examination. So that ends my talk on the structure of the course and the assessment blocks. Next, I'm going to tell you about the student profile, i.e. who are likely to be your mates on this course. I'm glad to say that this course attracts a wide range of professionals working in health and social care, local government education, as well as the voluntary sector. In terms of the educational background of the students, our students tend to come with first degrees in health, social sciences, biosciences, biomedicine. And in terms of geographical location, students, we've got a very diverse group, I must say, coming from international, i.e. non-EU countries, and we also have some more students coming from UK and the EU. In terms of the mode, majority of the students undertake the course as full-time. And here you are looking at doing the course. If your plan is to undertake it as full-time, you are looking at doing the course over 1 year. For part-time, you are looking at doing the course over 3 years. And for full-time, for the year, i.e. for the first 2 terms, teaching usually occurs over 3 days. And for part-time, for the first year, you are looking at 1 to 2 days i.e. first year, talking about terms 1 and 2. Next, I'm going to show you an example of timetable. And here I need to emphasize that this example is based on last year. So this could be similar, assuming you are coming in this year or the next, you're likely to meet a similar or a dissimilar timetable. For the full-time students, the days that they were expected to come in for lectures covered Tuesdays, Wednesdays, and Thursdays. And for part-time, I mean for terms 1 and 2. And for part-time, for year 1, the expectation was that students will come in on Tuesdays and Thursdays, and in year 2, they tend to come in only on Wednesdays. Now, the beauty of this is that although you have a global timetable, you also have the opportunity of having your own timetable available online. So each morning you could have a look at your own timetable and see whether there have been any changes or not. And if there are any changes, they will be communicated through your timetable, which will be available online, or our online portal, which is called the Blackboard. Now, enough of the content, the timetable, and all that. I guess you are itching to know about what next after this course. So you come in, do this course for 3 years or 1 year, and I presume you definitely want to get a good job afterwards. So what do? I need to indicate that the family, and I use family for an effect. I don't see this course as a team. I think we are one big family. And our aim is to help equip you with the skills and knowledge, transferable skills, so that you could go out there and get a job of your choice. And we're quite passionate about this. We just don't talk the talk, but we walk the talk as well. And how do we go about doing this? We conduct annual employability events. And for those of you staying locally, I'm glad to invite you to our next event that will be happening on June 8th between 10 o'clock and 12 o'clock. And what do we do on this day? This day provides you with the opportunity to have interaction with potential employers. So we've got visiting professionals from the NHS, people working with voluntary organizations, and etc. Now, in addition to this event, which we organize annually, you also have the opportunity of interacting with a careers consultant. And this careers consultant, with expertise in assisting people write their CVs, to go for interviews, and etc., is stationed here at Brunel. So you have constant, all you need to do is to drop her an email and you can have the opportunity to meet her and she will advise you accordingly. We also equip you with transferable skills, and we do this through an academic development workshop, which is timetabled and is run both in term 1 and 2. Now, next, where are you likely to find yourself working after this course? There are a number of things that you could do. First among this is not in any other priority I need to state, is you could work in organizational development. And here, I'm talking about developing organizations to be more health promoted. Here, in organizations, you could refer to schools, workplaces, and hospitals. You could also work in community development, i.e. developing communities to be health promoted. Then again, you could work in strategic development, where you develop a strategic approach to improving health and ensuring that local, regional, and national policies that can affect public health do so in a nice and health promoting way. You could also work in partnership development. Here you could develop partnership with key people in communities to affect and influence public health. And then you can also work in health information, whereby you can develop, in collaboration with others, appropriate and accurate information about people's health, what social and behavioral factors affect their health, and what can be done, i.e. through suggesting interventions to improve people's health. And finally, you could decide to work in project management. And here, you decide to manage specific health promoting projects in order to ensure they are ethical, effective, and efficiently delivered. Destinations of previous students. So where, we're talking about your previous cohort, where do they find themselves after the course? One, we've got our students move to become directors of healthcare management services. Some of them are health advisors with charities. then some work in the NHS, and others to research and development coordinators. Or you, if you want to extend your education, you could do a doctoral program. I'm glad to say that one of my current PhD students happened to be a previous student on this course. So once we finish this course, you could put together a research proposal which could be an extension of what you've done during your master's. And there will be a team of experts here who will gladly be willing to supervise you. So this brings to end my talk through what the Masters in Public Health and Health Promotion is all about. But that's not all. This is not an event. I do see this as a process. So after you've heard this, if you want any information, you could email me. And as you could see, my email and contact number on the slide. Or you could email the course administrator, our lovely Karen, who will be happy to answer all your queries. Thank you very much for taking time to listen to me, and I'll hand you over to Yasmin for any questions.
Fabulous. Thank you for such an interesting presentation. Guys out there, you are more than welcome to email in your questions to Dr. Nana Anache. As you can tell from listening to him speak, he's very, very passionate about the course. And if you can come to the event on June the 8th, please do. Do they need to register online to come to that event, or can they just turn up? Do you know?
They could drop me an email, but if not, they could turn up on that day. We're happy to.
Do you know which room they need to? Which building is it? Is it Mary Seacole?
Yeah, they need to come to. So you get to Brunel and you ask for the Mary Seacole building, which I must say you don't miss. Very huge.
It's very big.
And then you come to room 114.
So it's room 114, and the Mary Seacole building is on the Kingston Lane side of the Brunel University campus. So and we also have visitor parking. And if you have any issues, just come to the Eastern Gateway building, which is the first main building that you'll see if you were to pull into the campus for directions, and someone will direct you. So what time is that event at?
The event will start as a 2-hour event. It will start at 10 a.m.
10 a.m.
and then at 12 noon.
Awesome. Okay, so nice early start, people. Get organised and come down. I'm sure it'll be definitely worth your while doing that to come and have a chat in person and talk careers and things and talk about the course. I can say from having met people on the course myself that it is a very, very friendly course. It's very, very well regarded. The course has got a great reputation. Okay, I'm going to take a look at our question box and see what we have. Okay, our first question is from Melissa. Melissa is asking, is there still time to apply for the course?
Yes, I'm glad to say there is still time. And actually, if you want to start in September, you've got a deadline is 25th August. So you need to put in your application by then. But then even after 25th August, you could still put in an application, and that will be considered on case-by-case basis.
Yes, absolutely. So Melissa, I hope that answers your question. Another question from, let's have a look. This is from Imran. He says, you said it was a 3-day-a-week course if it's full-time. How many hours a week roughly is that? Do you have a rough idea of classroom hours or timetable hours?
Yeah, roughly, you're looking at if it's full-time, then you're looking at 3 full days. So you're looking at coming in roughly around 9 o'clock and leaving campus around 4 o'clock maximum.
Okay, that's good.
But it's not like you'll be in the class from 9 to 4, uninterrupted.
Back-to-back hours.
Yeah, you're going to have breaks here and there.
We'll be nice to you. We'll let you have a break every now and then, Ron, okay? We're not that evil at Brunel. We work our students hard, but you do get to chill out a little bit. So, yeah, so I hope that answers your question on that. And Maria is asking, is there any funding available for this course?
Yes, there are funding opportunities because we want to get the best here at Brunel, and we don't want, we don't want to deter anybody coming. So one source of funding could be, you could look at a postgraduate master's loan scheme, And also, and this provide you loans up to 10,000 and are available to students studying eligible master's courses from September 2016. So you're eligible and you can look at it and give it a go. In addition, there are also existing loan facilities, IU funding facilities here at Brunel. So you are looking at some scholarship schemes here at Brunel also, which these are all available on our website.
Yeah, so if you basically, like Dr. Nana has said, if you look directly on the brunel.ac.uk website and put in funding or loans in the search bar, Maria, you will be able to see what is available. And it is on a kind of like, there is obviously qualifying criteria, but, in terms of the actual studying, you can get some assistance. It's just a case of looking into it and seeing what's available, but the information is all online. And Libby is saying, she says, I haven't visited the campus. Can I still come on a campus tour?
Yes, and I think Yasmin will know
probably know a little bit more about this question, yeah.
There is a virtual tour online,
Yes.
so you don't even need to come here. You could go online and you get a tour of campus. And I guess in addition, you could also arrange to come in by sending emails, which I think Yasmin
Yes,
knows the details
yes.
better.
At the moment, the last time I looked on the website, there are new dates waiting to go up. So it's a case of, if you're just relying on website contact, it's a case of kind of watch this space. So what I would suggest is that you actually send an email to openday.booking@brunel.ac.uk. I'll say that email address again, openday.booking@brunel.ac.uk. And if you can just ask them to keep you in the loop with when campus tour dates come up. They tend to be on a Wednesday. Wednesday tends to be campus tour day at Brunel. But I'm sure if you were to write in, they would be happy to arrange a student ambassador to show you around campus. The campus is brilliant. It's like a little self-contained village, isn't it? Maybe we should talk about the campus a little, the actual campus.
Yeah.
What would you say you like about the campus?
First thing, I think diversity. So you come to
very.
Brunel, that's the first thing you'll see. And it's, so you've got facilities on campus. So you've got a Costa on campus, you've got shops, you've got a bank on campus. So you've got facilities, so you probably don't even need to go to Osbridge Town if you need something. And then we've got a very nice library, which is well equipped with all your books that you need. And I would say one key thing, not just diversity, but friendly people.
Yes.
People full of smiles.
Yeah, absolutely. I mean, I did my own degree here, and you did your PhD here, didn't you?
Yeah.
So they must have done something right, because we've come back here,
Yeah.
So the other thing is that you can there's actually like a bakery that comes, you get a bakery in the opposite the student union, don't you?
Yeah, and also health and health promotion and public health. So we need to talk about lifestyle behavior as well.
Yes.
You've got a fruit market as well, which
Yes.
comes in every Tuesday.
Yeah, it's really nice.
At affordable prices. So there you go.
So yeah,
That's why we're not leaving. We're still here.
Correct. We come for the fruit and veg, and I secretly come for the chocolate flapjack, to be honest. But it is a very, very friendly campus, and it really is one of the cases I would say that really the best thing to do is to come and pay a visit and try and attend an event where you actually get to maybe meet course leaders like Dr. Nana Anajay. And you also get to appreciate his amazing sartorial dress sense. He is easily the best dressed doctor on our campus, and you have to see it to appreciate why I would say that. Honestly, he's a very dapper dude. He really is. Okay, we've got one more question. I think this may be. Oh, this is a fantastic question. This is from Io. Could I use this qualification abroad? Is it internationally recognized?
Definitely. So we have, I'll say majority of our students are international, coming from an IO, by your name, I presume, from Nigeria. So
Good
we
Nigerian name.
we have our students coming from Nigeria and going back afterwards. So you could work in, it's internationally recognized. You could work with international organizations like WHO, World Bank, and etc. Yeah.
So I think it's one of those courses that people are getting a greater awareness of, with public health and health promotion. And health is a universal thing, isn't it? At the end of the day, so the more awareness people have of what ramifications there are with policy, especially in terms of how it affects the civilian population. It's really important, I think, that people do take these courses and take them out into the world, really. Is there anything else you'd like to add? Because I think our questions, those are really great questions, by the way, people. Thank you very much for them. Is there anything else you'd like to add, do you think, before we run out into the sunshine and sunny
and
Brunel?
enjoy the sunny day. All I'd like to say is to thank you very much. That it's really been great having you join us, and then we hope that we answered your questions. But then, as I did say, let's not see this as an event; it's a process. So keep your questions coming in through the emails, the email address that you can see, as well as phone numbers. It's all your choice. And I hope to see you all in September.
Excellent, excellent. Well, I'll say goodbye as well. I just want to say thank you for attending our Public Health and Health Promotion MSc online presentation and Q&A. I hope you found it interesting and informative, and that, like Dr. Nana Anache says, that we will be seeing you at Brunel in September. That is now the end of our webinar, but a recorded version will be available on the Brunel website shortly, and it'll also be going up on YouTube. So do spread the word, and like Dr. Anache says, if basically we haven't answered a question that you felt too shy to ask, or it's only just popped in your head later, do drop him an email. His email is on the screen, as is his phone number, and we can help you in any way we can. We will definitely do so. So all it remains for me to say now is to say goodbye, and thank you for attending. Thank you very much.
Thank you. Bye.
Bye.